Now we'll discuss the chest X-ray of a person with an implanted ICD. ICD is Implantable Cardioverter Defibrillator, which automatically detects cardiac arrhythmia, and if it is life-threatening, will treat either with overdrive pacing or with a shock. Sometimes when the shock is being prepared by charging the capacitor in the ICD, temporary overdrive pacing may be tried, whether the arrhythmia can be averted by overdrive pacing. This is useful for ventricular tachycardia of lower rates. If it is ventricular fibrillation, there is no question, immediately defibrillation shock has to be delivered. This is the X-ray of a person who has been implanted with a single chamber ICD. You can see only one lead. In dual chamber ICD, there will be an additional lead in the atrium, right atrium, which will help in diagnosing the arrhythmias. Because when there is an atrial lead and an atrial electrogram is picked up, it is easier to find out whether the given arrhythmia is atrial or ventricular in origin. So the discriminatory algorithm will be better for a dual chamber ICD. This is a single chamber ICD. You can see one lead going down up to the right ventricular apex. There are two high voltage coils. This thicker portion is the high voltage coil in the superior vena cava and part of the right atrium. This is another high voltage coil in the right ventricle. In addition to this, always ICDs have facility for backup pacing. You can see two electrodes here, the proximal electrode and the distal electrode. In addition, you can see the spring here. The spring-like structure is a screw which is used to screw in the lead into the myocardium. Screw-in lead is shown here. That is, you can carefully watch the spring-like screw lead over here. That is for anchoring the lead. So, when there are two high voltage coils, the shock vector can be programmed in multiple ways. It can be between the pacemaker can and the right ventricular electrode, or between the pacemaker can and the high voltage electrode in the superior vena cava, or even between these two. So multiple shock vectors are possible. Then some studies have shown that programming the high voltage coil in the right ventricle as positive or the anode will give better thresholds and lesser chance for precipitating ventricular tachycardia or ventricular fibrillation when shock is delivered for ventricular tachycardia. That is, increasing the arrhythmia severity. But in modern ICDs, since the shocks are biphasic, that is, one vector like this and another, always there is reversal in the same shock itself. So polarity, programming of polarity is not that important. Still, when there is a higher threshold seen, when the defibrillation threshold is higher, it's always worth trying different configurations and change of polarity to see if the defibrillation threshold comes down. Then what is the need of backup pacing? There is something known as post-shock bradycardia. After a defibrillation shock is delivered, most of them will have transient bradycardia. That will be taken care of by the pacing electrodes. If the rate goes below a particular level, this will automatically take up, and ICD always has a backup pacing function. And in addition to backup pacing, there is also overdrive pacing, which can be used to suppress or terminate ventricular tachycardias of a lower rate. When it's very fast ventricular tachycardia, if you wait for overdrive pacing, the person may deteriorate and have hemodynamic problems. So lower rate ventricular tachycardias can be overdriven by using the pacing electrodes.